Good afternoon, everybody, or good morning to you if you're on the on the West Coast. Welcome to NCSD's series of It's Your Call. Today's call is Using Community Engagement to Promote Sexual Health for Youth. Our calls are usually about an hour. We might run over a few minutes. We've got some really great lineup of speakers, and so we wanted to make sure we had ample time. So please remember that we might just run over a couple of minutes. My name is Charlie Ravens. I'm a technical assistance consultant with the National Coalition of STD Directors. I'm going to be assisted today on this call with Stephen Hicks, who's our Health Equity and Capacity Building Manager. And just, for those of you who haven't been on the call, NCSD conducts a series of calls, usually every month or two, to really promote what's going on in the field so that people can learn from other project areas what's working and what's not working so that we can really replicate the things that are working and be effective and not really recreate the wheel. So I think this kind of cartoon really kind of captures what we're trying to do is, again, there's a lot of great stuff that's going on, as you're going to hear from our speakers today, and I think we can learn a lot from each other on what works and how to be effective. A couple of housekeeping things, items. Please make sure that your phones are muted unless you're speaking. We will have a couple of minutes after each speaker for questions, as well as at the end of the session, we'll open it up for questions. And so if you are going to ask a question, you have the choice of either asking a question during the question time only, or you can send us a chat question and we'll be monitoring those, and we can ask those questions of the speakers either, again, during that question period of time or at the end of the session. As we said, this call is being recorded. We usually make a copy of the recording as well as the slides you're going to see available both on the NCSD website and the NPIN website from CDC within about a week after this session. Again, if you have any questions or comments, you can either use the chat function or hopefully after each speaker we'll open it up for a couple of minutes of questions. Again, please remember to mute your phones unless you aren't speaking. So we always do a quick poll to make sure we have a feel for who's on the call today. So if you could tell us primarily where you work, it's not who you work for, but what setting you work in. So do you work in a local health department, a community-based organization or non-governmental organization, state health department, you're at CDC, in the Division of STD Prevention or academia? So take a second to vote. So it looks like almost, 90% of our participants today are either from a state, local health department, or a community-based organization, which is great. That's our target audience. We really want to make sure that we are providing content and information for people that work in the field. Another quick poll question before we get started is, at this point in time, prior to this session, how effective do you think your organization is in promoting sexual health for youth? And just, one of the responses, very effective, somewhat effective. If your program doesn't do any work for youth, then just put not applicable. So about 70% of you say that you're somewhat effective, and about a quarter of you say that you're very effective. So I think that's a really good start, and hopefully by the end of the session, we'll have a lot more people feel that at least they have the skills to be able to be, next time answer, very effective. We have a great lineup of speakers. Like I said, my name is Charlie Ravens. I'm doing the introduction, and we've talked about the call purpose. And then in a minute, I'm going to turn it over to Candy Hadsall from the Minnesota Department of Health, and then you can see there are other speakers. So again, every presenter will introduce themselves very quickly. Prior to this session, we asked our presenters to really address 4 key questions. Why and when did you develop sexual health programming that targeted youth? What were some of the opportunities and challenges you faced in planning and implementing your program? Somebody has their phone not on mute. If you could mute your phone, please. How do you evaluate your programs and interventions, and what outcome data do you have? And then lastly, how can health departments work collaboratively and effectively with community-based organizations? I know that's a challenge for a lot of us who work in a state or local health department is how do we work effectively with community-based organizations? And I think we have a great lineup of speakers, and they're going to sort of tell us from their perspective how to do this. So our first speaker is going to be Candy Hadsall from Minnesota Department of Health, who is kind of going to give us an overview from the State Health Department of how they started, what they kind of did to help jumpstart the project, what they learned, and then we'll turn it over to some of our community-based organizations. So Candy, you want to take it away?
Thanks, Charlie. And thanks to NCSD for inviting us to do this. I think we're all really excited about this opportunity. And I'm really excited for everybody on the call to get to hear about the great work that's being done by our partners in Minnesota, because there's some really exciting and I think cutting edge stuff happening here. So and I forgot, I am the STD nurse specialist at the Minnesota Department of Health. I'm also the former IPP coordinator for those of you on the phone that have had IPP funding in the past. And part of my job is working with communities in a variety of ways, as well as doing training with medical professionals. So today is talking about the community side of things. So I just want to give you a little context, because the most important part of this call is what our partners are going to have to say today. So I'm just going to provide a little bit of context for how we got to where we are now. In 2009, we were getting ready to publish our 2010, 9 or 10 data report, and we were going to put into our press release highest number of STD cases ever. And we had put highest number of cases of STDs ever for the last 4 years prior to that. And in 2009, we said, we need to do something different. So we realized that we needed some change. We had, in fact, been working in the community in a variety of years, both with IPP and another HIV prevention education and other programs for some years. So some of the relationships that have been built in these projects actually started a long time ago. And I would just say that I think we've learned a lot in working with the community, and that the key thing is probably building relationships. So our initial activities were that in 2010 we applied for and were awarded a $10,000 mini grant from the National Chlamydia Coalition. We were one of 10 projects funded across the country. And we used that funding to convene the Minnesota Chlamydia Partnership. And in August of that year, we held a summit. The Minnesota Chlamydia Partnership was designed to be a whole cross-section of stakeholders. I'm going to talk about a little bit more about that in a second. And the main purpose of the partnership was to raise public and professional awareness and support communities in taking action. We realized that we needed help from the community. In 2011, the Minnesota Community Partnership members and other volunteers across the state, a total of about 300 people actually involved, developed the Minnesota Chlamydia Strategy. And on this slide, you can see the link to the strategy. You can go to that and read it on our website if you'd like. In 2012, we looked at the fact that people were probably not going to go online and read a 75-page report. And so we worked with a graphic designer by the name of Glenna Shea from the University of Minnesota. Some of you may have worked with her on other projects in the past. She worked with us to help create this document, a special report, Chlamydia Prevention, which is the user-friendly, colorful, easy-to-read presentation of the strategy. And we're really proud of this. We still use this today, even though some of the data is a little outdated. The rest of it is, all the ideas that are in there are still great. So it's also available for download on our website.
Okay, and I may not be able to hear you also.
And so the next slide talks about our talks about our basic philosophy that we went into this with, using the model of community engagement or empowerment. And it's because we believe that the entire community needs to be involved, not just health professionals. And it's based on the community organizing principle that the people who are most impacted by an issue such as chlamydia are the people who should be able to define the problem, understand the reasons why, to help create and implement solutions themselves, and that our role is to help support them in doing that, but it's not to run the program. So our model involves all of these people that you see listed in this community wheel. And I will say we aren't yet successful at having members of all of those groups in our statewide group, but we still keep trying, and it still is the model that we wish to emulate. And since we developed the MCP, we've discovered some concepts. We didn't have these to begin with, but as we've gone along, we've discovered some concepts that have really formed the foundation for the work that we're doing and the creation of the MCP. The first one is that chlamydia is more than a medical issue. Yes, it's a medical issue, but it's much more than that because it's impacted by the social and cultural determinants of health. That's a really key thing because it's important for, I think, health departments to understand that there's no way, at least this is what we believe in Minnesota, there's no way that the health profession itself or state health departments can begin to tackle an epidemic the size of chlamydia by ourselves. We need help from community members, and not just from medical professionals, but from others as well. So that's what we mean by that. We looked at the fact that we use the disease intervention model, and we still do use that, and it's a key part of what we do. But we realized that public health departments have been using that model since 1937, and that it is necessary but not sufficient to deal with an epidemic. It's not possible to deal with an epidemic one person at a time. We also believe that the top-down approach is often not very successful, that it's a better process to energize stakeholders and empower communities to design and implement the plans themselves. That people sitting in the health department offices looking at our data, we're not the people who know why what's happening is happening or what should be done about it. So we really believe that we just need to be a partner in that and not the leader in that. We believe that there are many activities that are worth pursuing, even in the absence of government funding, that usually people will say, well, we can't do anything about chlamydia because we don't have enough money. So what we've tried to emphasize is that there are lots of activities that communities and individuals can do that don't take money. Yes, we need more money. We obviously need more funding, but we clearly there are things that resources, including people and time, that can be offered by communities in this effort, and those don't depend on money. Obviously, we're focusing on chlamydia, but it is part of a broader focus on sexual health and sexual rights. And the last point, which is that we believe that it's important to advocate for the young people who are unable to advocate for themselves. So young people who are the people primarily affected by chlamydia don't have the power or the resources to do that kind of advocacy for themselves. And so we need to help advocate for them until we can pull them along with us and let them take the lead eventually. And in that process, it's a difficult process because it means we've got to confront ageism. Why is it that the majority of cases of chlamydia are in young women under the age of 30? Sexism is obviously a part of that. Racism is a part of it because we have great disparities in Minnesota in this health area as in many others, so we know racism contributes to what these rates look like. And also classism, knowing that a lot of the people that we work with come from circumstances where there is a lot of poverty or lack of resources around them, whether they live in the cities or the rural areas. There's just a lot of lack of resources to deal with chlamydia. So these are the basic things that form the foundation for what we do. And so I want to talk briefly about the projects that the Minnesota Chlamydia Partnership and the Minnesota Department of, these are primarily Minnesota Department of Health projects because that I'm going to describe next, because these use our STD CDC funds. We don't get any funding for chlamydia in Minnesota, so these funds are our federal funds. So in 2012 and 13, we had some funds that needed to be spent by the end of that year. So we funded a coalition in a rural county with some relatively high rates of chlamydia. a local public health department there, and we asked them to be a demonstration project for us and to develop a toolkit for other communities that might want to organize. So they did that and did a great job, and we learned some things about working in a rural community. In 2013, once again, we had some unspent funds and needed to spend them by the end of the year. So in June, we funded the creation of a coalition in the urban part of Minneapolis using the same model of community empowerment. That is the group that eventually has become CRUSH because they became very successful and were able to, after that process that we funded, they were able to get their own funding and move on, and they've really developed a lot, and you'll hear about that in a minute. And in 2015, last fall, we put out an RFP and funded 3 community groups to implement actions from that strategy that we looked at a few minutes ago. And these had to be new and innovative ideas. We asked people to really think outside the box. If they could do anything they wanted to do, what could they do? And they had to use community engagement to determine what these projects were. So this was a very different RFP process than usual because it meant that to use true community engagement, people who applied could have an idea, but they couldn't have the whole idea fleshed out to put into a complete proposal. And we knew that that would be kind of difficult for them and for us to monitor as we went along. But we really believed that that community engagement piece was key to making these projects work. So these are the 3 project areas that you're going to hear from in the next few minutes. And we're just really excited about the work they're doing and hope that you like that too. So now I'd like to turn it over to Charlie to introduce our projects.
Great, thanks, Candy, for that really good overview and just, the role of that of the health department in this process. We probably have time for one question right now, and then we can take some more at the end. So if anybody has a question, you can unmute your phone or send us a quick chat question. If no questions, we'll move on. So we'll give it like 20 seconds first, see if anybody has a question. Okay, and just as a reminder, please keep your phone on mute if you're not presenting. Okay, so hearing no questions, and again, feel free if you think of a question for Candy or any of the presenters, you can send it to us on the chat feature, and then when we get a break, we'll ask the question or at the end. So without further ado, I'm going to turn it over to our first community presentation by Nicole Elliott from the City of Minneapolis Health Department and Desmond Grady from the Neighborhood Health Source. So Nicole and Desmond, take it away.
All right, thank you so much. So we are here representing CRUSH. That's one of the 3 community partners Candy mentioned that was lucky enough to be granted with funds for that community engagement strategy to reduce chlamydia infections in Minnesota. CRUSH stands for Communities Restoring Urban Youth Sexual Health. The Y is silent. About us, I'm Nicole Elliott. I'm the co-chair of the CRUSH Affordable and Accessible Health Services Action Team, and I'm also a public health associate with the Minneapolis Health Department, and I'm here with Desmond Grady.
And I'm Desmond Grady, co-chair of CRUSH Communications Action Team. I'm also community health outreach with Neighborhood Health Source.
So what is CRUSH? As Candy mentioned, CRUSH is a partnership of youth-serving organizations and community members. We were formed with some startup funds from the Minnesota Chlamydia Partnership in mid-2013, again to address the increasing rates of chlamydia infections among teens and young adults in our community. Our mission is to mobilize individuals, organizations, and the community to eliminate chlamydia infections in Minneapolis through advocacy, education, prevention, and treatment. Our vision, we envision our community being a thriving place where young people are healthy, safe, knowledgeable, hopeful, and connected to adults who care about them. So we take a very much positive youth development approach to our work. We see youth as valuable assets in our community. We believe that all youth deserve respect, including people of all genders and sexual orientations. We believe sexual health care and education should be available to everyone, and that parents and other caring adults have an important role in promoting healthy sexuality and relationships. We do a lot of work in the community. We're going to talk about just a couple of things today. We'll be speaking about our youth council. We'll be speaking about the initiative that was funded through the State Health Department. It's called our Secret Spread It, Talk About It initiative. And then we'll also be talking about our Youth STI Testing Day.
Okay.
So the first thing I'd like to talk about is our Youth Leadership Council. There's a photo of some of them there. We have about 20 youth aged 14 to 18 years old. They are all young leaders who are bringing their voice to the community. They attend outreach events, they work with their peers, and go to various other community organizations and events to teach and promote to the community the importance of sexual health. They are compensated for their hard work. I think in the summer they meet with us once a week, and then throughout the rest of the year twice a month. So they're compensated for their hard work with meals and stipends as well. So with the Youth Council, we have planned an initiative called the Secret Spread It, Talk About It initiative. Basically what this initiative is going to be is over the next 2 years, we are going to work with our Youth Leadership Council to throw a lot of community engagement focused events to improve the sexual health of our young people ages 15 to 24. And we'd especially like to focus on reducing disparities. I'm not sure if we mentioned this already, but there are a lot of health disparities, specifically around youth and youth of color in Minnesota for chlamydia infection. So starting this August, our Youth Leadership Council is going to host several events called Sexual Health Nights Out. They're going to be located in schools or community centers or gyms that are youth-friendly, and they will have entertainment, music, spoken word artists, food, games, prizes, as well as peer-to-peer education that will be led by our Youth Leadership Council and include free STI testing. And that's being planned and hosted completely by our Youth Leadership Council. And CRUSH is really just there. The adults of CRUSH are just there to kind of help support their ideas. Then in spring 2017, we are going to host a Battle of the Youth Council. We have a lot of youth-serving organizations that have youth councils in the Twin Cities area. Right now, the way we wrote our grant, we had suggested the idea of a Vine contest between Twin Cities area youth councils. Of course, next spring, Vine could be a completely outdated social media mechanism, so we will leave that up to our youth to tell us what they would like to do. But we envision a fun, engaging battle between the youth councils where they can film short videos or use other methods of social media to promote awareness of youth sexual health and win prizes and awards if they end up being the champion. And then finally, we will host in fall 2017 the Bring Out the Parents and Guardians Forum. These are going to be intergenerational, community-based conversations about the chlamydia epidemic facing our youth in Minnesota. And so we are clearly taking a very community engagement and positive youth development focused lens with this initiative, and we're very excited about it. It is completely youth-led, so we are spending the majority of our time planning with our youth council all of these different events. That's very important to us. So finally, one of the projects that I would like to talk about is our statewide STI Testing Day. It was an expansion of our first initiative in 2015 for April's STD Awareness Month. CRUSH hosted the first ever Twin Cities Youth STI Testing Day. It was kind of a bit of a pilot project, and we recruited 18 clinics to participate. We ended up testing 99 youth on that day. It was April 21st, 2015, and we found an 11% positivity rate for chlamydia. So in partnership with the Minnesota Chlamydia Partnership and state and local health departments and private clinics across the state, we worked together to bring a task force together and bring this event statewide this year. So in 2016, April 12th, we ultimately had 56 clinics participate across the state of Minnesota. That included 16 school locations, so high schools, colleges, and universities, community colleges. We had 16 Planned Parenthood locations participate statewide, 9 local public health clinics, as well as 15 nonprofit and private clinics, who all agreed to provide low or no-cost STI testing services on the same day or during the entire month of April to youth. So as you can see, it was a huge expansion of our initial 2015 event, and we're actually hoping to continue to expand it further statewide in 2017. We're using a little bit of the walk, crawl, run model here. So this was our crawl phase, and we're very excited about how great the community response was for this event. So our results are pretty exciting. We know that we served at least 1,100 walk-in patients on April 12th or throughout the month of April this year. We performed 909 chlamydia and gonorrhea tests, and as well as 371 HIV tests, 134 syphilis tests, 38 trick tests, and 30 other tests for STIs among youth. I just got a question, is it possible to slow down for those of us taking notes, or will the slideshow be shared later? I'm not sure. I know Charlie said that we're recording, and I am also more than happy to email out our slides if you want to contact us later.
Yeah, we will be making. Yeah, and we will provide the slides. We will be posting them out to both, I said, NCSD website as well as the NPIN site. So, and anybody can also contact us, but we do make all the slides and the recordings available. Okay.
Thank you. So our results from our event are that we had about an average age of 18. We had data on about 50% of the patients. We know that this was our first time expanding this project, so we didn't want to have a ton of demands for clinics to participate. If they were willing to offer walk-in services for youth, we didn't also want them to have to do a lot of reporting to us, but next year we hope to improve on that. So 18 is exactly in our ideal age range. If you exclude the schools, we were just a little bit above the age range we were targeting at about an average age of 26, but we're still very happy with those results. We had an overall positivity rate of 7.6%. We identified 63 chlamydia cases through this event. And just an interesting note, we didn't do very many trick tests, but for the trick tests we did, we found a positivity rate of 8%. And again, as Candy mentioned, this was all completely done with in-kind work. We received a couple of donations to promote things over social media or radio, but otherwise this was all completely just staff in-kind donations. There was no funding for free testing. No one was compensated for their work beyond it being an in-kind donation from their position. So we're very happy with the results of this. I'm going to go ahead and turn it over to Des so he can talk a little bit more about the youth engagement and social media components of this work.
Also, I would like to mention that youth leadership matters, and a lot. Having youth at the planning table is key. Youth understand social media at a level that even professionals may not understand. Youth holds the key to successful media marketing. The youth, they meet on Saturdays, and they help create the promotional material and the content that we use for social media, like created the hashtags for social media, the posters you see in the photo as well. So here are some of the hashtags that they created. And one thing I would like to mention is that they take the negatives that's around the community. Everyone watch the news, hopefully, or hear about the news, but they take those negative messages and they make them positive. And we had a great outcome because of it. So here are some of the primary hashtags that we came up with and some of the ones that the youth came up with that was great in reaching the youth. And one thing about hashtags is it helps you gain a lot of organic reach versus paid reach. So we had a small budget to pay for a little bit of promotion, and then after that, the organic reach helped multiply the reach that we got. This is a very diverse youth council from different parts of the city. They work together well, and, I mean, it's just phenomenal. So here are some of the tweet and share schedules that we had, and you can see we basically took the STD release from 2015, and just so happened we planned the STI Testing Day the day after, so a lot of that was mixed together, and we got some news coverage from local news stations. We reached over 8 million readers, viewers, and listeners via 80 media outlets and online news outlets. If you could take a look, I'm pausing so you can actually read some of the hashtags and the materials we used. The teams took negative messages and made them positive. I want to put emphasis on that. With the $200 budget for social media, we were able to reach over 4,000 individuals in the United States, 1,100 in Minneapolis, and then there are other small cities following after that. We have a 57% with women, 43% we reached in men, and you can see on the bars the age, the 18 to 24, the 13 to 17, 25 to 34. So it was a success. And one thing I would mention to anybody who is doing this work is youth matter a lot because they know things that we don't know. They can reach the youth that we cannot reach. And it would be key to keep them a part of everything as far as planning, implementing, and then actually doing the work. And so I basically want to go through this fast so it leaves time for questions because I really want to hear what you guys have to say.
Yeah,
go ahead.
Thank you, Charlie. Go ahead.
No, great presentation. I think, we do have time for a couple of questions. I think what's really great is, maybe any lessons you learned about engaging youth, as well as I think you guys really should be commended for, collecting and analyzing your outcome data. It's not just doing the intervention, but seeing how effective it was. And I think obviously your interventions are very effective and becoming more and more effective as you kind of gain experience. Let's open it up for about 2 or 3 minutes for questions. Any questions from the audience? Feel free to unmute your phone and ask your questions or send it to us via chat.
Hello.
Go ahead.
Hi, my name is Marielle Edge. I'm calling from the D.C. Department of Health. My question is, during what time span did you reach the 4,000 people through social media?
So that was within the day of.
Oh, wow.
On the top of the screen it says within 28 days. That was actually a snapshot of after we shut down everything, more like 6 p.m. we were done. This is actually the day of. And one thing that was perfect was the release of the data information from the state. And we piggybacked that with the youth because there was a lot of negative messages. And like, say, Fox 9 up here in Minnesota, they put up a post about the data release. And under there, you could see the negative comments, and it was just gross. So what we did was promote our testing day under those comments. So if anyone said anything negative or gross, we would just post and we would show the work that we are doing to combat that. And we would ask them to, hey, if you have a concern, why don't you join us and help us, fight this problem?
Okay, so we have time. We have 2 chat questions, and then if you have any other questions, we'll take them at the end of the session. So our first chat question is, can you talk about the participation of young men versus young women? Any suggestions for engaging one sex versus the other?
Yes, absolutely. So we're pretty happy to have, kind of almost parity. I didn't include this, the stats for gender breakdown because not every clinic gave us a good breakdown, but it looks pretty even to us, about 50-50. The key that we found in working with our youth is make it as easy as possible for men to come to the clinic. A lot of women are already fairly engaged with clinics and the health system in general just through reproductive health needs. But men in general really need to know that they're going to be welcomed in that space. So we need to make our clinic waiting rooms youth-friendly, and there needs to be walk-in hours that are clearly advised, and just make sure every interaction is really positive with young men. I see there's another question about recruiting youth for our Youth Leadership Council. We also have really good gender parity on our Youth Council. This CRUSH is, again, a community-based organization, collaborative amongst many different organizations. So we have good relationships in the school-based clinics and with other community health outreach workers. And so they reached out to youth, and then other youth, this is our third year, and so other youth recruit their friends as well. And we found that that really recruits a lot of young men as well, because they're very interested in this work.
And to piggyback on that, a lot of the youth from previous youth councils either send younger siblings or other friends who wanted to be a part of it, but we didn't have the space for them because we capped off at 20. So that was another way to engage them. And also taking one youth council member from other organizations who was a part of CRUSH, and if they had them, we took those as well.
Great. Okay, so we're going to move on. Great information. Again, we'll have time hopefully at the end of the session for questions for all or comments from our participants to all our speakers. So our next presentation is going to be from Juan Jackson and Shai Ellis from the High School for Recording Arts and their Check Yourself Health and Wellness Center. So Juan, take it away.
Good afternoon, everyone. This is the Check Yourself Health and Wellness Center, and for 25 years, we've been a community-based organization statewide, but community-based, working really in sexual health, but specifically in teen pregnancy prevention, HIV, STI risk reduction, just generally youth risk reduction for behaviors. And similar to what Candy said, I want to sort of reiterate some of those points. And that was different about this. And if you're at a health department, whether it's local, city, or county, or statewide, to think about. And one is in developing a request for proposal. A lot of times the health departments define the problem and then they also define the solution. And they usually use a medical model. And as Candy said, the medical model has not really worked. It hasn't solved the problem. We've seen rising sexually transmitted disease infections, particularly chlamydia, over the last decade in Minnesota, and it's been true elsewhere too. And so that was something different about this request for proposal from all the others that we have applied and work in. Another thing that was very different is it was a little bit more open-ended. And so not only did they not define the problem, but as a responder to the request for proposal, we didn't have to have all the answers. They didn't come to the community and say, you know, we have this problem and you have all the answers, and so do whatever you want to do. It really has been a partnership. And I do think that that is about relationships. And so this probably wouldn't have happened the way that it happened had the Minnesota Chlamydia Partnership not worked for 5 years or so previous to the RFP doing the work that we all did as part of that. Also, and this is sort of reiterating something that Desmond and Nicole said, that we have been a premier peer education program for 25 years. And so it's not so much that we had a youth council. We really had a group of peer educators who always informed what we did. And so they would look at, say, a menu that we gave them, and then they would brainstorm other ideas about what to do. But often their hands were tied because they had to do something from a menu of evidence-based programs. Unlike many of the other things that we currently do, this was not that. And the youth development ideas that they had, peer-led ideas that they had, we were able to use. And so our programming has mostly been, or at least right now, has been evidence-based curricula. So we do CLA, we do Safer Choices, we do SHARP, and those are evidence-based curricula, very well known nationally and used by many different programs. But what we're doing right now is really a storytelling intervention, and it's quite different from anything that I think could come out of sort of the evidence-based model, even though it has roots in the AIDS community demonstration projects that the Centers for Disease Control did way back in the mid-'80s. And so youth create and write stories about chlamydia. They then share these stories with friends, not with strangers. And so the message and the medium are also important in this. The youth develop stories that flourishes with their culture. And so in the same way that, say, they learn about trends and slang and dances and gossip and friendships and relationships, all the things that are part of youth culture, they use that or should use that to craft the story. And that would be about chlamydia. These stories maybe wouldn't even necessarily mention chlamydia, but they still would be about relationships and about chlamydia. And this may make a difference in reducing chlamydia infections, and it may make a difference in who gets tested and treated. But it's really a media campaign. And the only way to really understand it is to see it as a media campaign. So one of the questions that Charlie asked that we were supposed to answer early on is, how do we evaluate? Well, you would evaluate the way you would evaluate any community-level intervention, not a group-level intervention, so nothing like the curricula, which all tend to be group-level interventions, and nothing like sort of the case management models or other kind of models that are individual-level interventions. This is a community-level intervention, and so you would evaluate it as you might evaluate other media, but we may not have, all the resources to do that as well as could be. So to give you an idea of some of the and this chart is just getting back to what I said, and that is that it's all about partnerships, relationships, and thinking about what does the community really need. And so that's both defining the problem as well as the solutions. If the State Department can do it by itself, then by all means let it do that. If the medical model at clinics can do it by itself, then by all means let it do that. But of course that would not work and has not worked. And so you do need to bring in everyone, and no one has all the answers, including the community. But I would say that it's important to listen to the community. I'll give you a very specific example of that is someone keeps asking how youth are involved. Well, you can't get youth involved without food. You can't get youth involved without feeding them. And if you have a program that thinks that means some 99-cent snacks, excluding tax, that's not going to work. They really want to eat, and they want to have camaraderie and enjoy one another. So you also got to have that kind of social time, and that requires a different model than just solving problems like chlamydia. And so I can just say this about Candy. She gets that, and certainly crafted the RFP, but also in conversations once our program was selected, allowed us to build a budget that included food at a rational number of dollars per participant. And that's just a very concrete example of how to get youth involved. So this is one story, and of course, similar to what I said about the medium, this is a text type, and this really is a real story in a way. It happened. We've changed it a little bit, but this person is talking to their girl, their friend, and they're saying that you should get tested. And then they're saying, you were the last person that I had sex with, and so maybe you have something because I got tested and I have something. But if you really read this, there's something that should jump out at you. And so I'm going to give people a chance to read it quickly. So what should jump out is this person is trying to make himself look good. He's lying. And he's lying about two things. One, they would have treated him immediately, right? He had symptoms. They would have treated him immediately. And if you're going to do expedited partner notification, they would have done that immediately too. And so it may be that he decided after his test results, or actually the test results had not come back, but he may have decided after the test and after getting treated that he would tell his girlfriend this way. And then as he's telling her, decided to do, lying, basically. And so this is a really good example of a story that's very useful, partly because it gets at, do you tell, do you not tell? I'm of the age that if somebody told me that I should get tested through a text message, I'm coming through that phone. But they're young, and they do these kinds of things over the phone or text messaging or however else all the time. I guess he could have Snapchatted. But it isn't probably appropriate for everybody, but certainly this is part of youth culture and youth development, and they do it all the time this way. One of the things that this points out, of course, is how then do you share real information? And so if the youth are sharing false information, like you got to go back and you got to do this, or you can get medication for somebody else, is that really true? Because as you see, she says she's going to go on her own and that she regularly tests. And so she's very surprised and very frustrated. Some people, other youth that saw this said, this is not how somebody would respond. They would be saying, you know, cursing and saying all these other kinds of things that are inflammatory. But this is a very formal young man, yet still a liar in this case. And he does come off this way. He does present himself both to girls and to adults this way. The next story is not a story. One of the things that we have done as part of our 25 plus years of working with youth is about every 5 years or so, we've put out messaging through music. And so we're at High School for Recording Arts. And the very first creation from High School for Recording Arts was an STD, really HIV tape that was made almost 20-something years ago. And the last one was just made about a year and a half ago. And so this is messaging, and it is targeting many of the same people, but it's different from the chlamydia story projects that we're engaged in right now, in that it's not shared one-to-one, and then there's not a conversation about it. And so that part of the intervention is extremely important. And I just wanted to contrast that from some of the work that we have done in the past. This next story I'm actually not going to read either, because I think that you can see it very clearly on the screen. It has a lot of complicated issues, and it points to why an evidence-based model would probably not work very well in addressing the community the way that these stories are. One of the things that I used to say in talking about this story is that I, in 30 years working with youth, have never had a group of young men that have not raised issues about their erections at some point if you're doing comprehensive sexual health education. And this story points that out. But you often can't find that in evidence-based models, or even models that are medical-based. And so those kinds of things are missing. A lot of the issues that he's raising about so-called halo effect, you know, who looks good, who smells good, who has money, who lives outside of, let's say, the poorest neighborhood, and so may take risks with that person that you would not take with somebody else. Often programs don't address that. And so you could look and see this story. I just want to leave some time for questions, so I'm going very quickly. Just want to end with the programming that we do is, again, peer-led, adult-guided, and it's programmed that I think really is the best of youth development. And so it's about their resiliencies, it's about what they know, what they can not only contribute, but what they can change because of their actions. And I think that the stories that we're collecting, we have about 20 right now, all sort of get at that in different ways. And then we haven't really got to the place where we're sharing them yet, but the goal would be to sort of use kind of the RDD sampling or snowball type sampling to start a lot of different places and share the stories throughout the community. And so in 2017, that's most of what we will be doing. And so that is it.
Great. Thanks, Juan. It was a great presentation, you know, great work that you guys are doing. We probably have time for a couple of questions before we go to our last presenter. So does anybody have any questions or? So, you know, in your experience, what are some of the secrets to engaging youth? You know, if you have a recommendation to our participants.
Well, the secrets to engaging youth are not that different from the secrets to engaging adults, in the sense that it is, as Candy said at the very beginning, about building relationships. And if you really love young people and want to solve the problem, you're going to do that. They're necessary to be at the table. They're necessary to be part of all our partnerships, and you really got to listen. And so it's not just be in the relationship, but to really listen. And that sometimes means that they will say things that don't fit neatly in the sort of models that we have developed, but you still got to listen to it and then try to change those models. It is not hard, I don't think, but I do think that if you're at a local or state health department and working with the community and working with leaders and stakeholders, that includes young people at the center.
Okay. Two chat questions. First question is, have you been able to evaluate for results?
Not yet. So we're work with a gentleman at the University of Minnesota to figure it out. We may do, well, I don't want to say what kind of evaluation we're going to do, but there are a lot of ways to evaluate community-level programs. They're all difficult, much more difficult than, let's say, group or individual-level interventions. And we're looking at one in particular.
Okay, and last question is, do you address relationships between older men and younger women?
Well, I don't know who asked that, but we could talk about that offline. I don't think the data really has supported that as strongly as people think. For many years, that's been sort of a stereotype, but both in our programming as well as in the data that we collect here in Minnesota and what I know of the national data, it doesn't bear out that many first pregnancies or many STDs are caused by a much older and a youth. Older adult and a younger adult or a young person.
Okay, great. Well, again, thanks for that, great presentation. We'll move on. Our next speaker is Hillary Zander from the St. Paul College and the Face-to-Face Initiative. So, Hillary?
All right. Thank you. So my name is Hillary, and I'm a health educator at Face-to-Face, which is a nonprofit organization on the east side of St. Paul. And we serve youth aged 11 to 24. Face-to-Face was founded in 1972 and reaches about 3,000 youth annually through a variety of programs. So we have reproductive health care, general medical care, counseling, prenatal care, health education, and programs for youth who are homeless or at risk of becoming homeless. So I'm going to talk specifically about the project Face-to-Face is currently implementing at a community and technical college in St. Paul called St. Paul College. And that's to address the high rates of chlamydia and through the funding from the Minnesota Department of Health Chlamydia Strategy as one of the community groups. So Face-to-Face chose to apply for the grant as obviously chlamydia and STI prevention was an integral part of our clinic work. And then we chose St. Paul College specifically because we already had a relationship with the health education from department from Face-to-Face already had a relationship with the college, and also their student body represents the demographics we aim to reach. So we are targeting the upper half of the 15 to 24-year-old cohort, most at risk of STI infections, as well as the fact that young people of color are disproportionately impacted by chlamydia and other STIs, and the majority of students at St. Paul College are students of color. And so Face-to-Face came up with a list of goals that we wanted to implement at St. Paul College. As you can see on the screen, increased knowledge of STIs, so just general information, how to prevent them, safe sex, increased knowledge of where and how to get tested, an increased rate of students and their partners tested and treated for STIs, decreased shame and stigma around sexual and reproductive health topics, and then increase in self-efficacy of students and their ability to negotiate with partners and practice safer sex. And so in striving to brainstorm and create a grassroots-focused initiative centered around youth and student voices and leadership, we proposed to create a student association to accomplish these goals at St. Paul College. And so the student association then became central to our project at St. Paul College. And after doing initial work to gain buy-in from the college administration, we spent a month recruiting students. So I went into classes, I tabled outside of the lunchroom, and then after that month had gone by, we had a group of 8 students who were committed to meeting weekly, and for each time that we met, they were stipends, $10, and then we also provided food and other incentives. So the Student Association came up with a name for themselves called the STI Awareness Project with the tagline, Fighting the Stigma. And then they also created a mission statement, which, as you can see, says we aim to organize projects at St. Paul College to raise awareness and educate about STIs, fight the stigma around STI prevention and treatment, offer support and resources, and advocate for a safe, sex-positive environment. And so the Student Association was entirely student-led, and again, I, as the adult, kind of served to help guide and help facilitate meetings, but it was primarily what the focus was on the creativity of the students who were in the association. And we had a very diverse group of students in terms of age. We had some students as young as 18 to up to 30, and then also in terms of gender identity, race, and area of study. And so throughout the semester, so this was last spring semester, we put on 3 different campus events.
But I'm asking, so I'm listening to some stuff.
Sorry, just something.
Please make sure everybody's phone's muted unless you're presenter, please.
And so one of the events that we put on was with Valentine's Day. So we passed out 150 flowers with information about chlamydia and where to get tested. We also did a presentation, a TED Talk presentation on race disparities in STI rates, and this was through the college's Diversity Awareness Month. And that was, we had 8 students who attended that presentation, and so it was kind of a poor turnout, but then kind of to make up for that, we did a poster session in the lunchroom. So we did the same presentation and attracted 50 students. And so we measured that by kind of how many water bottles that we distributed at the event. And then we also put on an STI bingo event, which was a pizza party with prizes, and the students in the association came up with a list of questions about STIs, and they created the STI boards and then, or the bingo boards, and then that was attended by about 30 students. So we evaluated the campus-wide events through the student association members' feedback after each event, and we tracked how many students we reached by keeping track of the number of water bottles or condoms that were passed out. Additionally, we, regarding evaluating the student association itself, the members in the association took a pre and a post test on the first and last meetings to measure increase in knowledge of reproductive and sexual health issues. And then we, the association then reevaluated goals and kind of discussed how to overcome challenges faced at the end of the semester and preparing for this coming fall. And that said, some of the challenges that we faced include that there's no health center at St. Paul College. And so this is also an opportunity, as there's a really great need for reproductive and sexual health education, but students don't have easy access to somewhere where they can go to get tested and treated. In addition, there isn't an easy partnership that can be made with administration to ensure long-term sustainability of the project, as a clinic would have been a natural fit, and that we found that with working through the Student Life Center, which is where we currently have a relationship with, that center is totally swamped, and it's been really challenging to work with professors and department heads. And so additionally, in working with the Student Life Office Center, there's been a lot of turnaround in that office, and so that has kind of put a lot of projects and goals on hold. So that's definitely one of the biggest challenges that we're facing at St. Paul College. Another challenge is thinking about how to really measure and evaluate our work meaningfully in terms of the goals that were previously made up or previously laid out. And so we have to kind of think creatively about how we're going to measure increased testing without access to an on-campus clinic, and how we're going to measure increased knowledge on a campus-wide level. But that said, one of the really great positive outcomes of this project so far has been the students who are involved in the association and their passion for it, and then their commitment to being involved in it this coming fall. So that's really exciting, as we have about 5 students who are going to continue involvement, and that'll be a great opportunity, as we're not going to have to completely rebuild the association come fall. And additionally, we're hoping to expand the project to include a reproductive sexual health peer education component, because right now, last spring we did majority large campus-wide events, but the students recognized the need to really be able to meet with one-on-one with other students to kind of talk about questions that they might have about reproductive health or sexual health issues. Additionally, we're hoping to partner with other student associations to increase the scale and attract more participants to events, and then possibly bring a mobile testing unit to St. Paul College. So all these goals for the future were goals that were brainstormed by students in the association, and we're hoping we'll be able to implement them this coming year.
Great, thanks, Hillary. I think in the interest of time, we'll go through a few things and then we'll open it up for questions for all the presenters. So let me move forward because we are at about an hour. Here's the email information for all our speakers. Again, the slides will be posted up on the NCSD website as well as NTEN. And if anybody needs them, you can always email me, and I will provide my email address. Just a couple quick poll questions. If anybody feels that they need some technical assistance for working with youth or CBOs, if you could tell us yes or no. And we might be able to, if you say yes, maybe link you up with somebody. So feel free to take this poll question real quick. So again, if you feel you need some technical assistance, we're going to give you some suggestions on where you can get technical assistance in a second. First of all, any of you that have a CDC grant, you can always talk to your program consultant, or if you don't know who your program consultant is and you can't get a hold of the director of your program, you can contact Steve Shapiro at CDC, and he can link you up to somebody in that branch that provides technical assistance. The National Coalition of STD Directors is very geared towards providing technical assistance. We do these programs as well as, we have a legislative team, and we also have a specialist on adolescent sexual health, Sarah Stahlberg, who works a lot with the community education funded areas around the CDC's Division of Adolescent and Sexual Health. So we have somebody on staff who can, also link you up with TA or help provide TA. If you're working with PrEP issues and special populations, our colleague Stephen Hicks at NCSD can help you out. So NCSD is a really great resource for providing technical assistance. So as a result of this webinar, was this webinar useful to you? If you could just tell us, and if it's not, we'll give you a way of, giving you some feedback on how we can improve it. We'll do a quick test on this. So about 60% of you, or almost 100% of you, said it was either somewhat or very useful. So that's helpful to know. Again, I'm going to open it up for questions in a second for all our speakers. I really want to thank our presenters for doing a great job, not only for all the work that they do on a day-to-day basis, and the work that's done in Minnesota is some of the best, really, community engagement and youth work I think that's being done in the country, but not only for all the work that they do, but taking time out of their busy schedules to put together these presentations and participate on the session. Again, we will be posting materials, and so if you have questions that you think of later or you want some technical assistance, feel free to reach out to any of our presenters, and I'm sure they're more than willing to give you some advice and help out. And one of the things we are going to do is at the end of the session, you will get a link to a quick SurveyMonkey survey evaluation of this. So we really want feedback on, did this session meet your needs and suggestions for either improving the session or what other topics you would like us to present. So let me open it up for questions. If you have questions, we have one. Okay, so any questions for any of our presenters? So I have a question for Hillary. are there different strategies that you use to reach the older students? I mean, the ones like maybe 22 to 24 versus 18 to 19. Are there different engagement you would do, or you do things pretty similar?
I think we did things pretty similar. At St. Paul College, one of the ways that we really engaged students was kind of through like thinking about this as like participating in this student association is something, you know, that will build your resume, or that will like lead to potentially like a job experience or something like that. So in terms of recruiting students, there really wasn't much difference between the age groups, but just kind of focusing on how this could be a unique experience to their college experience. And then the group of students then who came together, so as I said before, they were kind of all ages, so from 18 to 30. And they, you know, worked collaboratively to really put together the events that we did on campus. And the events were very diverse, and so I think the different strengths kind of came out with different ages and different ideas about how to best bring forth the information to the student body.
Okay, we do have one chat question. I'll open this up for all our presenters or anybody else want to comment from the participants. Can anyone speak to the work they are doing to include queer and trans young people?
This is Hillary, and I can speak to that too, because we had students in our association who identified as genderqueer or bisexual, and one of the student associations on campus is a LGBTQ student association, and just the nature of the reproductive sexual health programs and campaigns that we were doing, it was kind of a natural fit with the programs that the LGBTQ partnership was doing, and so we did a collaboration between our two organizations, and that has been really helpful in bringing out those voices into usually campus events or where those voices aren't heard or prioritized.
Other presenters want to comment on that issue?
Yeah, this is Juan Jackson. We work with a lot of the students that are here at our school, and I would say 1/3 of the girls self-identify as gay, bisexual. We also have transgender students. Unfortunately, we have not collected any stories from them yet, or from others at other schools and other programs. But the work is still the same, and so it's still building a relationship with adult leaders and working with the youth, presenting to them and trying to gather the stories and following up. And so I'm sure we will, but we just haven't been successful yet.
Any of our other presenters want to comment on that question? Or any of our audience want to chime in? Okay, we probably have time for one or two more quick questions. Anybody else from our either presenters, feel free to ask other presenters questions, or if there's something that you didn't make a final closing remark anybody wants to make, feel free to any recommendations to our participants that you want to make?
I guess this is Candy, and I think what I would say is that the whole community engagement process has been a wonderful thing to pursue, even though not everybody here in the health department, in the STD program anyway, was initially enamored of it, mostly because not having had experience doing that. So we did run into some resistance more in the beginning, but the more success that we've had and the more things that have happened, the less the resistance is. And so I would just encourage state and local health departments to just take the risk and say we want to use the community engagement approach. What can we do to work with communities and ask them what they think needs to be done. So I'd just like to encourage people to not be discouraged by any negative feedback if you get any, and just plow ahead.
Hello. This is Charlnita Ellis, Shy Ellis, Mama Shy, Director of the Check Yourself Health and Wellness Center that Juan so eloquently represented. I just want to speak to the community engagement part as well. I want to just say good job to everybody. This is incredible work, but this cannot be done successfully without community engagement. It's just what's going to have to happen. And I've been, at this for 25 plus years, and always with the focus of young people. And I know that we have to not invite them to the table when we get through after we've made a decision and all that. We got to make sure that the young people are at the table in the beginning of the process, as well as, the other community members. But when we're talking about youth, they're offended when we have an agenda and we're doing what we do and then we invite them. If we say their numbers are growing and they're a part of the problem, they need to be at the table when we begin the conversation about what it is that we're going to do, what needs to be done. We need to be asking them, what is it that we can do to help you to lead this charge? And so I just wanted to say that and just thank you to everybody who's doing the work. We have to continue, and we must engage the community.
Yeah, great comments. And I think one final question is, a lot of people working in health departments are they're not comfortable in working in community engagement. Please make sure you mute your phones if you're not talking.
I'll cover it.
Okay, so I think the issue is from our presenters, what recommendations do you have for people working in health departments? How do you just jump in? What do you recommend? Maybe some of the if you haven't done community engagement work, where do you start?
This is Nicole, and I, speaking as an early career public health professional, I had no idea what I was getting into, and I feel like a lot of older people had a lot of, excellent wisdom and advice and cautionary tales for me. But having no idea what you're getting into and just doing the work was actually really helpful. I didn't listen to we had no money, no budget to do statewide STD testing or no grant writing experience, and sometimes that's really helpful. So just do it and see what happens is the method that worked for us. So
I would say you have to be willing to provide a little in-kind work. And at this level, a lot of us don't get off at 5 o'clock. A lot of us don't stop working until 8:30, 9 o'clock, depending on the day, or even on the weekends. I would say the most important thing, and I will piggyback on Mama Shy, is to involve the youth early. I started this work straight out of high school, and I was blessed to be a part of this work early. And I think that's the key is creating these avenues for these youth to be able to step in our shoes once we are done with this work is the best way.
Great.
And this is Candy. I'd also just piggyback on what Nicole said about just jumping in there and doing it. I think what I've fallen back on every single time with anybody is the numbers. The numbers have defined why we need to do this. And I've asked people for other things they think we should do instead, and I don't get very many responses. So to me, this is the work we need to be doing, and it needs to be with the community, and the health departments have to be willing to jump in, try new things, and get out of our own way so that community members can take the lead.
Great. Well, that's we're about 1:15 or 2:15 Eastern Time. I really, again, want to thank all our participants, again, especially for keeping your phones muted, as well as our presenters for doing just a fantastic job. Feel free to reach out to any of our presenters. I mean, I think they've done just fantastic work. They'd be a great resource. I'm sure they'd be willing to give you some advice. We'll have their email addresses out to you. So thanks again, everybody, for participating. Any last remarks before we shut the call down? from anybody. All right. Well, thanks, everybody. And again, please remember to fill out the evaluation form and continue the great work. Thanks.
Thank you.
Thank you.